The World Health Organization, WHO, has said it is too early to declare an international public health emergency over the coronavirus outbreak as 6 people are tested for the illness in the UK. The Scottish Government has confirmed 5 people are being examined after presenting with symptoms of the illness. Another patient is being tested to rule out coronavirus at Belfast's Royal Victoria Hospital, it is understood. It came after infections expert Professor Jurgen Haas claimed there would likely be many more cases around the country. On Thursday evening, the World Health Organization said, the Emergency Committee on the new #Coronavirus, 2019 #CoV, considered that it is still too early to declare a public health emergency of international concern given its restrictive and binary nature. Speaking at a press conference, Dr. Tedros Adhanom Ghebreyesus, Director General of the WHO, said, "Make no mistake, this is though an emergency in China. But it has not yet become a global health emergency. It may yet become one. All but one of the 18 deaths have been in Hubei. There are now more than 600 reported cases in countries including Japan, South Korea, Singapore, Thailand, the US and Vietnam." Dr. Tedros said the fact he was not declaring a public health emergency of international concern, FEIC, should not be taken as a sign that WHO does not think the situation is serious. He added, "We are aware of media reports of suspected cases in other countries, but those cases are still being investigated." While none of the UK cases has been confirmed as the virus so far, 2 of those being tested in Scotland had been diagnosed with influenza after travelling to Wuhan, China. A further 3 people were undergoing testing on a similar precautionary basis. A spokesman for the Scottish Government said, "As the situation develops we will update should there be any confirmed cases of coronavirus, rather than provide a running update on cases being considered on a precautionary basis. We are co-orientating with Health Protection Scotland, a daily incident management team, to continue to monitor the situation as it develops, including on the number of any potential cases going forward." Downing Street said 4 suspected cases in Scotland were believed to involve Chinese nationals. They all travelled to Scotland from Wuhan, where the outbreak is thought to have originated, within the past 2 weeks and were showing symptoms of respiratory trouble, a red flag for the virus. Dr. Tedros said, "We know that most of those who have died had underlying health conditions such as hypertension, diabetes or cardiovascular disease that weakened their immune systems. We know that there is human-to-human transmission in China, but for now it appears limited to family groups and health workers." For more on this story, visit the news article link.